I'm Erin Martin. I'm the founder of FreshRx Oklahoma. It's a produce prescription program where we reverse type 2 diabetes with regenerative fruits and vegetables. I have attended the Soil Climate Alliance meeting today because I'm really drawn to the work around nutrient density and the Nutrient Density Alliance and how that's really proving that regenerative agriculture creates health outcomes. And we need a lot more support around that. So I'm really excited to be with like-minded colleagues and talk really high level about how we really make these changes. I think it's shown me all these different folks that are involved in the regenerative ag space, from researchers to advocates to policy folks, and it's really stimulated more thinking in how I advocate for food as medicine programs and how we can prove and be connected to more data through the Soil Climate Alliance and with all the people working together to prove that this is really important. I see regenerative agriculture as a huge impact on the overall health of individuals, communities, and the health of our planet. I think that consumers are going to want this. I think younger generations already are, and I really believe that this is a revolution of our food system, the health of humans, and of our planet. And so I really see this as the ultimate change and what's going to make things a lot more beautiful and healthy for all of us. We have really created community around the FreshRx program. At our graduations, where our participants graduate after 12 months, we have the physicians giving testimony, how it's impacted their patients. We have the participants giving testimony, how this impacted their health and their family. And we have the farmers giving testimony about how this really changed and revitalized their passion for growing food and why they started to do it in the first place. And so we have created this community, and we've connected the synapses in the brain that's been very disconnected from nature. And we've created a whole community around this. We really believe that food connects us all and it heals us all. And for people to know that their neighbor worked really hard to grow nutritious food for them to heal themselves, it has created an amazing connectivity together in our community, and people are rallying around this and just want to be a part of it. It is really important for us to support the capacity of our participants to be able to not only come to the water, but know how to drink, and not only to be able to eat fish, but to know how to fish. And so that's what we really focus on. That's why the food is a teaching tool, but the education and the lifestyle changes are key. We're helping them understand where can they access this food outside of the program and beyond the program. We're teaching them how they could grow their own food. We're teaching them how they could shop smarter at Dollar General, for example. How they can use double up food bucks with their SNAP benefits to access regeneratively grown fruits and vegetables, and how to get transportation to the farmer's market to access that. So we're doing all sorts of things to empower people, how they can and extend the life of those fruits and vegetables, and make sure that they know that it's not just wealthy people that can eat healthy, that anybody can eat healthy on any type of budget. You just have to have the understanding and the capacity to do that. We have definitely had challenges getting physicians to understand the importance of regenerative agriculture and food as medicine programs, but not as much as I thought I would. What's been really exciting is our initial physician thought we should just source from Amazon or Walmart. But I started teaching him about regenerative ag principles, and before we knew it, he was one of the biggest advocates for regenerative ag. He also started his own garden and started hosting these spiritual support groups for regenerative farmers. And this is what these physicians are starting to understand, and the physicians are influencing each other peer to peer. So we found other doctor champions in the clinics that really cared about this. And what we're really doing, and one of the biggest challenges is for people to understand the difference between a food as medicine program that maybe sources expired food or donated food or conventionally grown food, and the difference between programs that really hold people accountable in the program, but also that really specialize in how we're sourcing what we're calling medicinal food or food prescriptions. In order to scale food as medicine programs and repeat them in different communities, we think we are truly the blueprint for this. It's not a cookie cutter model. These need to be customized to communities, to different cultures, and they can be. And where we need to move in is getting health insurance to recognize food as medicine programs, particularly those sourcing regenerative ag, as a healthcare intervention. This is critical for us to integrate and to scale local and regenerative ag through the food as medicine market that could value on quality over quantity. This would really revolutionize healthcare. We could actually reverse chronic disease and do it in a matter of months or even years. And we can do that together, and healthcare is where all those dollars are, and there's incentives for them to create health outcomes, and that's what regenerative ag can do.